Time now for this week's Health Matters. Paul Critz with you, along with PA Lynn Szabo. And today we're talking teeth and drinking water, I guess, really what we're talking about is fluoride.
Yeah, and pediatric teeth.
Specifically pediatric teeth. Okay, all right. So we start out in our starting place is we live in a community that has taken the fluoride out of its drinking water. That happened, about 10, 15 years ago. And it was this big deal, and a whole bunch of political shenanigans going on with it and everything. But what's that mean? What's that mean for this community and for pediatric teeth in this community, though, not having fluoride in our water?
It means the amount of dental disease has gone up exponentially.
Has it?
And I'm specifically talking about children today. I'm a little bit over having that sweet little face look up at me with a big swollen cheek because their teeth are rotting. So I wanted to talk about what's in the along the lines of what's your plan B. So fluoride's not a thing for you. What are you going to do to take care of your kids' teeth? Mm-hmm, mm-hmm. And mostly when I ask stuff like that, I get kind of answers about why the dentists aren't doing it, but really the ball's in the parents' court. So, there's no pediatric dental care closer than Arcata and none that accepts Medi-Cal. So people are, just for reference, people are going to Redding and to Santa Rosa, and children are being put not really under general anesthesia, but kind of, I guess we could call it a twilight anesthesia, to get like all their teeth pulled out.
Oh my God.
At age 3.
Wow.
So, this is a thing. It had consequences, and here they are. What should the plan B be? And I just want to say that I went into the medical library to get my source on this. So that library is mostly called Up to Date. And this was Preventative Dental Care and Counseling in Young Children by Novak and Warren, up to date through February 2025.
Wow, okay.
Yeah, so dental decay is the most common chronic disease in children. That, blew my mind. And 8% of baby teeth and 29% of permanent teeth have cavities.
Wow.
Yeah. And then 45% of children ages 2 through 9 have cavities, 2 through 19. And 13% of these are untreated. Now, that's probably a generalized statistic to the United States, and I imagine that this is much higher in Del Norte. And it's really common to see decay in kids' mouths.
Wow.
And simple sugars are the cause, actually, not lack of dentists. You could also say a preventative measure could have been fluoride in the drinking water. But risk assessment, there are 12 major risks that they outlined in the article I read. But I'll just name the ones that are most relevant to Del Norte. And that kind of surprised me. So if a mother or a primary caretaker has active decay, then the child is at risk. Probably.
Okay. Wow.
Because of kissing and nuzzling and stuff like that.
Do you think it really is it communicable like that?
Apparently so.
Wow. It's not. I could imagine it's just if somebody can't take care of their own teeth, how are they going to take care of a kid's teeth? It
could be multifactorial.
Wow.
But I've also read for adults too that the bacteria that causes caries also can be kind of passed along in kissing and stuff.
I've never heard that. Oh my God.
Yeah, I know, kind of scary.
That is.
So exposure to tobacco smoke in the home, and I don't think what they really mean is like somebody's actively smoking in the home. I think what they mean is people smoking outside not paying attention to the 15-minute rule. So it takes actually 13.9 minutes for lungs to be anything but buckets of smoke coming back in the house. So after the last puff, people wash their hands, they change their jackets, they're really trying. But what really matters is waiting 15 minutes after the last puff.
Any indication, how does nicotine exposure lead to tooth decay?
Yeah, it happens in adults who smoke too. I think it probably changes the microflora and probably changes the bacteria.
Yeah.
Yeah, it probably also sets up a chronic inflammatory response. That would be my guess.
Okay.
prolonged use of a sippy cup over the course of the day. And I see this all the time in exam rooms. Sippy cups are kind of ubiquitous. So sippy cups should be handed to a kid. The kid should drink what they want out of it, and then it should be done.
Okay.
Either put in the refrigerator or sent to the dishwasher. So, and then low socioeconomic status, which of course, and some would say defines Del Norte. But probably part of that is you can't afford toothbrushes, you can't afford toothpaste. It's not on your list of the 10 things you need to live. This upcoming week,
and certainly dental care is way down too, because if you're poor in Del Norte, there's no place to even get that.
Right, absolutely.
Wow.
And then also insufficient fluoride exposure. Now it's possible for a child to get fluoride supplementation from their pediatric person. I used to see it happen all the time. Like when my kids were little, we lived in Blue Lake. There was no fluoride in the water there, although it was in Arcata and Eureka. So my kids were put on fluoride drops pretty early on.
Wow.
But they don't do that anymore, which I don't know why. I'll have to look into that.
What's fluoride do?
Fluoride strengthens the structure of the enamel of the teeth.
Okay.
So it just helps you set up a barrier to bad bacteria, sugar that's going to change the pH and cause focal decay.
Okay.
It's been well described since the early 1900s when a physician happened to notice that people that had access to fluoride, maybe through natural spring water or something, just had better teeth. And he looked into that. And it is a thing. It is not dangerous in the right dosing. And it's not dangerous because it has a long chemical name. That's the other thing that was part of the campaign was, the name is really long and medically sounding and scary. That doesn't define badness.
Yeah.
So what's a concerned parent to do? So encourage breastfeeding the first year. And actually there's a lot of women who nurse in this community, and takes dedication, takes community support, especially support from employers as women go back to working as nursing mothers. And I think at least in the Native community, it's seen as a really good thing, and they make it happen for women. So that's good. Early dental care. So when I'm in the exam room and I'm seeing like a little 4-month-old and mom's really proud of the first teeth that have come in. Usually it's the 2 bottom teeth and then the 2 central incisors on top. I make a comment about, that's great. So you should get him into the dentist at Smith River. And parents always express surprise.
Wow, really? You just got teeth. Yeah, no, that's it. I want to go back to the breastfeeding. How does that work? Is that just exposure to, the same old thing with breastfeeding?
I think part of the way of nursing kind of sets up the mouth to avoid malocclusion problems and probably little pockets where, food gets stuck. Some kids with teeth really wide apart don't have as much of a problem as kids that have teeth that are kind of on top of each other. And it also sets it up for easier flossing, but that's not the reason it was evolutionarily.
Okay.
And I think it probably has something to do with encouraging good bacteria in the mouth. So
okay, all right.
Probably less of the sugars that cause problems.
That was also another thing. Is there like a follow along, like the bad side to formula at all? When it comes to
I did not
care?
see any data on that, so I can't really answer that.
Yeah.
There's some good things about formula.
Sure.
Yeah.
I was just wondering. I'm just trying to get to what the underlying reasoning was behind the breastfeeding being a good thing.
I think it's the malocclusion thing, because I did see a reference to that. I think it helps the teeth line up and grow in, I guess, what we call straight.
Yeah.
Okay. So parents should brush their kids' teeth 2 minutes twice daily. I know as a mother that I'm like, really? There's no way.
2 minutes. 2 minutes.
Right. And if
they keep up in that time.
that never happens. Especially 2-year-old toddler is going to be grabbing the brush and wanting to do it
Right.
themselves and then suck on the brush. But anyway, so good luck with that, you guys. So if the child is under 3 years old, then you're using a small rice-sized glob of fluoride-containing toothpaste.
Yeah.
If the child is 3 years and above, a pea-sized glob is good. And this, I would look for children's toothpaste because I think there's slightly less fluoride in that.
Mm-hmm.
And so it would be a little harder to get too much in there. But this number matters. And if younger kids get exposed to too much fluoride, they have some minor cosmetic discoloration of their teeth.
Mm-hmm.
And it's cosmetic.
They're not suddenly autistic, right?
Right,
It's like,
right.
yeah.
And it's, if you're going to hang your hat on cosmetic, I mean, 27-year-old women in this community oftentimes refuse to smile or open their mouths because their teeth look horrible.
Yeah.
And they're afraid people are going to judge them.
Yeah.
So, and not all of them are meth users. That should never be the assumption, in my opinion. Just as a little aside, I'm training a traveling physician at UHS this week, and I mentioned that some poor woman had really awful teeth that were just kind of brown nubs at the gum line. And he asked me to bring up a picture on the computer of it, and I showed him, and he was horrified. He'd never seen it before. And so he's a family practice physician with 30 years experience.
Wow.
Yeah.
Wow.
And he'd never seen it before. So he's going to learn a lot while he's here.
Welcome to Del Norte.
So supervised brushing daily for kids, especially up until they're about 8 to 10 years old. So interesting factoid that a kid doesn't really have the dexterity to brush correctly until they have the dexterity to be able to tie their shoes.
Wow, that makes sense. Sure. Yeah.
Yeah, well, it makes sense, but I didn't,
Yeah, right.
Yeah, kind of weird. So up until they're about 8 to 10, they should be supervised in their brushing activities by their parents at least twice a day, and probably more if they've just gotten home from the fair where they ate a lot of sugary snacks and stuff. So fluoride clearly helps dental health. And the risk of a little bit of cosmetic staining isn't a big deal. But what about the National Toxicology Program's monograph on the state of science concerning fluoride exposure and neurodevelopment and cognition?
Okay, so tell me about this. When did this come out?
This came from IHSS that during the summer, kind of at the end. It was a monograph. It's about 325 pages. It's a scientific consensus, not really a meta-analysis, but a drawing together of data nonetheless, put out by this government organization.
And I'm sorry, which government organization?
I'm sorry, Health and Human Services.
Okay.
I think I said it wrong. And the interpretation was that there was that they uncovered a definitive link between fluoride in the water and IQ level in children. And that is not at all. You can, if you don't want to read the 325 pages, you can read like within the first 5 pages. They caution against people making that assumption.
So I want to clarify on this, because in the notes that you have, it says in the first few pages, it clearly says it does not address that fluoride exposure from drinking water is associated with measurable effect
That
on
was
IQ.
the assumption that people immediately made. And I never saw, like in the press, when the press was talking about it, I never saw that clearly stated.
I'm so misunderstanding what you're saying here. Maybe
Right.
it's the double negatives or the assumption being presented. But what? So the paper did or didn't say, what didn't the paper?
The paper did not address fluoride exposure in drinking water in association with measurable effect on IQ in children.
But people
what it did address.
But people assumed it did.
Right.
That's why you have that written here like
what
this.
it did address was the consequences of over fluoride exposure. Remember, you can get it from other ways besides drinking water. And they happened to find not they happened to find that those kids that had an overexposure to fluoride had a lower IQ on the whole. That does not mean that one follows the other.
Okay.
Okay, that's what they're saying. And it does not mean that they were looking at fluoridation levels, what's recommended by the World Health Organization as safe levels for water fluoridation. Okay, is that cleared up?
Yeah, that does. Yeah.
Yeah. So it also said it made their conclusion that children exposed to higher than recommended concentrations of fluoride are associated with decreased IQ. And they said they only had moderate confidence. And that they said it was specifically not a proven link, not really related to the standard concentration of fluoride that's usually found in drinking water.
Okay.
So every pediatrician I presented this to that looked at it, it's 325 pages, immediately said that this is nothing. This means nothing.
Yeah. This
Unless you're
isn't
going to
science.
force actual extra fluoride down a kid's throat, it still doesn't mean anything. Who would do that anyway? But so I don't think we can look at that as a way to say that, oh, thank God we have the fluoride taken out of our water. Because that's not what this is measuring at all, and nobody can ever use this as ammunition to justify their efforts.
Well, that's how it's being used?
Yeah. So, so not a proven link. So fluoride helps rural children keep their smiles, and I think until we have the kind of dental access that urban populations have, there's ways that we as parents can take care of our kids' teeth. And I think since it's hard to get dental care up here, your pediatric provider is probably the best person to be asking questions of. I have put it in my template as a reminder to me to ask questions during well-child checks about dental care. Although I resist the arena because I'm not a dentist. But in this case, I feel like this is solid information that I have a way to help parents make a good decision. And when you're thinking about plan Bs, as far as if you make the decision to support no fluoride in the drinking water in Del Norte, then if you want your kids' teeth to be healthy, and remember, dental health is tied to a lot of other kinds of health, mostly cardiac. If you want your kids' health, dental health to be good, then you step up to the plate. You don't blame the lack of dentists. You don't blame that, because you have Medi-Cal, those mean dentists are never going to take care of your kids. That's not true. Dental Medi-Cal is not really a thing. It doesn't really, the consumers think it's a thing, but it doesn't pay enough to keep a dental office open. And for the most part, it's really kind of depending on dental charity. And you can't depend on that.
No, that's not a plan. No.
So as a parent, you have to step up to the plate and do the best for your kids. And I hope there's some ideas in here how to do that. But I also wanted to bring something out and some changes that are in Project 2025 and how it'll change healthcare. It is possible that healthcare will no longer be paid for health conditions that are preventable. So as a way of saving money. So, for example, measles is preventable by immunization. So if you draw that out, it's possible that what they're talking about is if you didn't immunize your kid and your kid ended up on a vent, then that's your dime.
Wow.
And so I think the same thing could be, I'm not saying it is, but could be applied here. If you didn't look after your child's dental health, then the expense of driving them down to Reading and maybe staying in a hotel overnight is not the only expense you would bear if they need extensive surgery. So I really counsel parents to have a plan B that makes sense.
Wow.
So another thought on plan B is cod liver oil, just a little distraction here, is not the plan B to prevent measles.
Right.
There's some kids going into liver failure because they've been overdosed with vitamin A and cod liver oil.
Jesus.
It's not, you guys, this is complex medical stuff. It's not something you can wing as a parent. So,
Man.
very hard topic to write about.
Yeah, all of it. This is at the same time that they're chopping down all sorts of reference framework for healthcare, for people who are concerned about their health, for healthcare providers, and deregulating the space, and then also cutting off your access to any sort of recourse, any sort of healthcare at all. That's just, man.
And think about a 27-year-old woman in this community that has terrible teeth. You know, they won't even open their mouth in the exam room. How are they going to perhaps get a good job? You know, have the self-esteem to go to school.
Right.
You know, et cetera, et cetera. And it's not just women; it's men too. There's deep shame about the state of their teeth, and people come here. Dentists come here blown away that they see dental disease that they only read about in textbooks.
Wow.
So it's a big problem we have here, and we took a big step backward when we took fluoride out of the water. I suspect fluoridation of water would also help adults, because you know, when you go to the dentist, they want to know if you want the fluoride treatments and stuff. Even as an adult, I've had a fluoride treatment on my teeth in the last 6 weeks.
Oh, wow.
Yeah, so it's a thing. I suspect it's a thing for adults too, but gosh, if, you know, our kids, we always put our kids first, right? At least we should as good parents. So start thinking about how you're going to take care of your kid's mouth.
Wow. 2 minutes.
2 minutes.
2 minutes of Russian. There's your first challenge. 2 minutes. Also, don't rinse afterwards. That was something I really only learned as an adult. Actually, recently, it was like, you know, we do, you know, the mouthwash afterwards. If it doesn't have fluoride in it, then you're just washing away the fluoride you just put on your teeth. So
That's
don't do
true,
that.
and you put it in your stomach, which is kind of
It's not where, well, you know, you don't swallow the mouthwash, but yeah.
Yeah.
So yeah. All sorts of, you know, we're just dumbing ourselves down and taking away any sort of recourse or access to the healthcare that we need, and just going to be left on our own to, I don't know, the witchcraft to burn sage for our teeth or something. You know, anything goes online. And now the people who online, who have shared all this disinformation about everything from vaccines to fluoride and beyond, they're in charge.
Running the place.
Yeah.
Oh my God. Yeah.
Wow. What do you do? What do you do in that instance, man? I don't know. We just keep talking, I guess, and keep sharing. I'm not sure even how far here, you know, we'd. Because at the time when they were talking about taking the fluoride out of the water, just every healthcare person that I knew of stepped forward and said, no, this was a bad idea. Don't do this. And we did it anyway.
Yeah, and then nobody's talked about the consequences. So I hope this also opens that conversation.
Yeah.
Because it is horrific to see a child in pain like this.
Man. Wow. Something totally preventable, too. Okay. Well, what else you have going on? Are you doing?
I'm trying to get the pool guys back. The swim team wants to talk about the opening of the pool and some of the changes and what it means for actually teen health, you could say, in Del Norte County.
Yeah,
Super exciting.
And the pool is so, and I saw a live stream yesterday too. I guess they were, if they hadn't already opened, they were doing tours or something. And I'm happy about that. I got to wait for the pool to get back up to heat.
Yeah.
I'll start going back down there, because it's amazing how just 2 degrees can make so much of a difference for your experience.
Hopefully that burns off more calories. That's my theory.
Yeah, just the
If
teeth
you're
chattering.
freezing.
No, I got to give it above 80 before I'm in that pool. But yeah, I really want to get back into that. I'd like to start utilizing the pool more and get down in, because we are so fortunate to have just a remarkable public pool right here in Crescent City, and not every place has access to something like that. So, and you've got to get your group from UIHS, right?
Yeah. Wednesday night is UIHS night. It's free for UIHS patients. And the goal is to work on diabetes in the community. So lap swimming, water walking, or pool aerobics, and I hear the teacher is like really good. It attracts a lot of people.
Oh, right
so
on.
It's super popular.
Right on.
Yeah.
That's cool. Any idea about upcoming shows?
Besides the pool, no. Well, I was thinking maybe of things that surprised me in medicine for the week. Every week there's something that surprises me, actually more than one thing. And maybe talking about that is kind of a little tidbits of news.
Oh, that's interesting. No, because I like hearing that. I like hearing those things that people, when you were talking about how death of a patient can affect healthcare folks. And
Oh, yeah.
the whole,
I can talk about that.
Yeah,
I would
yeah.
be glad to do a show on that.
I think
It hit
watching
me this week.
Yeah, see, and that would be good to know. It humanizes the whole healthcare experience, and we're all, we watch the dramas on TV where everybody's jaded and they're having to go through it. You get just
That's
a moment
right.
to yourself to kind of go, ugh,
And we
then go
punch
on.
walls and stuff.
Right,
Yeah,
exactly.
we really do. We
that's
punch
true.
walls.
Wow.
Yeah.
Wow.
So.
All right. Well, I guess that's it for this week's Health Matters. Thank you very much, Lynn. We'll do this again next week.
All right. Thanks.